Hello, I'm Professor Farah Magrabi from Macquarie University in Sydney, Australia. Welcome to my Study Australia Masterclass. I'm a biomedical engineer by training. I was born in India and I came to Australia around 20 years ago and have made it my home. My research looks at digital health technologies. These are now everywhere. Computers have made their way into our hospitals and into our general practices. My research looks at the safety and effectiveness of these technologies. In this masterclass, we're going to look at artificial intelligence in healthcare. We're going to consider the opportunities for AI in health and also its challenges. Let's start with the current challenges in healthcare delivery. Our health systems are facing many challenges. In January 2020, the WHO released a list of 10 most urgent challenges for healthcare systems globally. These include elevating health, delivering health in conflict and crisis, making healthcare fairer, expanding access to medicines, stopping infectious diseases, preparing for epidemics, protecting people from dangerous products, investing in the people who defend our health, so investing in the healthcare professionals themselves, keeping adolescents safe, and earning public trust. It's noteworthy that the Director General of the WHO remarked at the time that a pandemic could bring economies and nations to their knees. Indeed, we're seeing this play out before our very eyes. The most important or significant threat to our health is the effects of climate change. In fact, climate change has been described as the greatest threat to public health. In September 2021, editors of the leading medical journals around the world got together and published a joint editorial calling on governments to take this seriously and to tackle climate change. Indeed, our healthcare systems are going to be or have to be transformed to deal with climate change to becoming more environmentally sustainable. And any transformation is going to change the way clinicians work, and digital health technologies will play a greater role in that transformation. So digital health is the use of IT in care delivery. The widespread use of mobile phones and handheld devices has given us access to medical records and health information at our fingertips. Indeed, digital health technologies have allowed us to play a greater and more active role in maintaining our health and fitness. Chances are that you're already participating in digital health. Do you have any health apps on your phone? Are you using any apps to track your exercise, your sleep, or have access to your medicines information and other healthcare records? We're also increasingly using our phones to keep records of our vaccinations and talk to our health professionals. If you're doing any or all of these things, chances are that you're already participating in digital health. For doctors and nurses, digital health is essentially about digitizing health information or turning it into electronic form. In the old days, when you had a prescription that a doctor had scribbled on, it was usually hard to read and it could lead to errors in giving the patient the wrong medicine. Now that we are using electronic prescriptions, chances are that they are more eligible and they can also be checked for mistakes. For doctors and nurses, digital health is all about digitizing health information or turning it into electronic form. So we no longer have a prescription that is on paper, but it is stored in electronic form. That allows a doctor to check that prescription for any errors, and also it is more legible and can be read by a pharmacist who's dispensing the medicine. Digital technologies support a range of tasks. The most significant of those is decision making, because it's all about providing information to health professionals at the right time to support their decisions in making a diagnosis, in treating patients, in prescribing medicines, retrieving the right kind of information from the evidence, and also alerts and reminders. And we're going to keep coming back to decision making in this masterclass. The other important function of digital technologies is in messaging, whether it is about sending an order for a laboratory test or sending off a referral to a specialist. A third area where digital technologies are important is in record keeping, because then you can go back and look at that information and it can also be searched easily. Health processes are also being automated. So once you have health information in digital form, clinical processes can be automated. The example I have here is pathology testing. There are many tasks in this process, including the test being ordered, the specimen needs to be collected from the patients, the test gets done, and then the results become available, and then they need to be read by a clinician. In a digital world, critical information required to complete these tasks is provided by IT systems. Similarly, for other processes such as medicines, there are many tasks in the process. A medicine is prescribed, it's checked by a pharmacist, it's then again checked by a nurse and then administered or given to a patient. Having this process digitized allows for checking to happen automatically. And so doctors and nurses can be alerted to errors. For instance, if a patient is prescribed a medication to which they're allergic, the system can alert them about that allergy. And then the doctor can go in and change that medicine so then the patient is not harmed by that medication unnecessarily. Similarly, nurses are able to check that the right medicine is being given to the right patient. Information to support clinical processes also comes from medical devices. So increasingly, we are joining up medical devices to the networks in hospitals. So what we have seen is that digitization of health services has now been underway for over 20 years now. And what we've learned from this is that healthcare is a socio-technical system. Essentially, what that means is it's about joining up the tools, the people, as well as the processes around them. So not only do we need to make sure that the tools can be used and they support clinical processes, but they need to fit the workflow of doctors and nurses. And we'll come back to this when we look at AI. So artificial intelligence is essentially about teaching computers to do what humans currently do. In the last few years, we've seen the re-emergence of AI. We're using AI systems to undertake more and more tasks. And if I asked you to come up with an AI system, chances are that you will think up a robot. And yes, robots are an important part of the mix. Indeed, they may have a role to play in caring as well as in providing companionship in the years to come. But when we're dealing with health information, or when we're dealing with information or automation of that information, the AI in that is a little bit more subtle. Chances are that it's hidden in the search engine that recognizes that you're a cat person, or it's in the chatbot that you can talk to and it understands you when you're speaking. In healthcare, a major area for applying AI is to support clinicians in making decisions. And essentially what we are doing here is that we are automating the human processing of information. So the picture I have here is about a general process that humans go through when they are making a decision. We look out, we observe the world, and our senses basically gather information. We then process that in our brains, we come up with a bunch of options, and then we act on them. For instance, if I was trying to make a decision about whether I was going to wear an umbrella or a raincoat, I'd kind of look out the window, see that it's going to rain, process that information, and have a bunch of options up my sleeve, and then decide what I was going to do. In a similar manner, AI can be applied to process health information. So it's about automating one or any of these stages. So AI can help us in acquiring information, in analyzing information, coming up with a bunch of options for decisions, and then indeed we may also use AI to act on some of that information. We've seen that digital health is the use of IT in healthcare delivery, and with that, AI is about teaching computers to do what humans currently do. We can use AI to support decision making. So it's about using AI to acquire information, to analyze it, to make decisions, or to act on that information. In recent years, we've seen the reemergence of AI really because of the increasing amounts of data that we are collecting in our health systems. But what we've also seen is increasingly there is more and more computer power that is available. And from that, what's emerged is a method called machine learning. Machine learning algorithms or methods basically make inferences from data. So the idea here is that you show a computer a whole lot of examples to kind of teach it a certain task or a certain category. For instance, if you want to teach a computer to recognize a cat, you show it many, many pictures of a cat. And then so it gets really good at recognizing patterns. AI in health essentially is harnessing these new machine learning methods, but we're also going to integrate them with other reasoning methods. And the potential here is to solve some of the really important problems in healthcare delivery. There is also this idea of decision support for precision medicine. And so the basic concept here is you can tailor treatments for individual needs. And that's essentially the promise of AI. So the promise here is that we're collecting more and more data in the health system. But it's not only health information, it's also about information about a patient's genetic makeup as well as their social and environmental factors that affect their health. So we have the ability to harness all of this information to provide more precise treatments that are tailored to the individual. The picture I have up here is of a neural network. So essentially, these are machine learning methods that mimic the actions of a human brain. And more recently, we have deep learning, which is essentially a neural net with many, many layers in it, which is able to churn through a lot more data and kind of decipher many, many patterns. So let's now look at the opportunities for AI in health. The first area where AI is really important is in providing information for clinicians to use in their decision making. The picture I have here is of an AI that looks at pictures of the lung. So basically a CT of the lung. This is a 3D picture, and it provides a quantification of the lungs, the lung lobes, as well as the lung lesions. And clinicians can take this information and decide on a diagnosis. So the AI in this case is behaving like a calculator, where it's processing information and providing basically parameters for clinicians to use in their diagnosis. The advantages in using this kind of AI is that it's not prone to error. These calculations could also be done really fast by a machine compared to if we had to sit down as a human and do it. The second area where AI is being applied is in assisting humans to make decisions. So the picture I have here is of an AI system that detects risk factors. And the advantage of a system like this is basically a second pair of eyes for the humans. So in some cases, a clinician might kind of squint at an image and then want another opinion. So the AI here is basically providing that kind of role where it's assisting humans to detect these fractures. The third area where AI is being used is where it decides in place of a human expert. The example here I have is IDXDR. So this is an AI device that looks at the pictures of the back of the eye and detects a condition called diabetic retinopathy. So ordinarily, a patient would need to be sent to a specialist to have this kind of screening. But with an AI system, this kind of screening can be provided in a primary care clinic. So saving the patient the trouble of having to see the specialist and sometimes even traveling to the city to see such a specialist. So with a system like this, we can provide more screening in rural areas where less specialists are available. So let's now move to the challenges with AI. Essentially, all AI systems start off with a bright idea that it might be good to build a kind of system because data is available. And so really the first stage starts off with this process where data is captured, it's cleaned, it's labeled, and then you go on to kind of building the model and testing the model. The last mile is where things start to get really interesting because it's about now taking the system and applying it in the real world and trying to make sure that it can be used by clinicians in routine care. And that's when things start to get really complicated because we need to make sure that these AI systems fit the way clinical work is undertaken. So we go back to the idea of it's not only the technology, but then how that technology fits with the people and broader processes around the technology. One of the main issues with taking an AI system into the real world is this notion of generalization, whereby the AI has been trained with data from a certain patient population, but then where you apply it in the real world is quite different from that population that was used to train it. So the picture I have here is of an AI system that detects skin cancer. Now, the problem arises when it was trained or when it was developed, it was only shown pictures of light-skinned people. So it's really good at detecting cancers in light-skinned people. And the problem arises when if I deploy it in a setting where it's going to mostly be looking at dark-skinned people. So that in itself is this notion of generalization, whereby we need to make sure that where we check whether the AI is going to be good enough for the particular patient population that we have at hand. The second issue is this thing which is called calibration. So if I take that skin cancer system that I have and it's been tuned to a certain population, so it's been tuned to mostly looking at skin cancers in young people, and I deploy it safely in a hospital. But then what happens in 2 years if I start to see less and less young people, but then most of the people I'm seeing in my clinic are older people? So the AI system may not work as well. And so what we need to do is we need to keep monitoring the population where the system is being used and tune the AI system to detecting cancers in that population. So we've considered problems with AI systems on their own, but there's also issues when we look at AI or automation in the hands of users. And one of the main ones to consider here is that automated systems make us humans complacent. A good example to describe this is how you use your GPS system. When we're using a GPS in our car to navigate from one place to another, we often jump in the car, turn it on, and just follow it. We very rarely check that it's going the right way because we almost trust it, even without kind of thinking too much about what it's doing. So we have this tendency to trust and to really give up responsibility when we use automated systems. Often there may be issues where you might follow the GPS because you're not familiar with that particular area of the city. You might be rushed, you might be distracted, or you're having a great conversation with somebody sitting next to you, so you can't really be bothered to keep checking the AI system. So this tendency to use automated cues as a heuristic replacement for being vigilant, for seeking information and checking the system, it's called automation bias. And it will definitely kind of affect our use of AI systems in health. And so we need to be training doctors and nurses how to use AI systems safely, to continuously be checking them, to sort of stay in the loop. Automation bias arises when AI works, but it's not perfect. There are other effects of automation on human performance that are worth considering as well. Even kind of the notion of checking an AI system, now that's going to increase the amount of work for a clinician. They're going to have to process more and more information, and so it's going to impose a mental workload. The flip side of that is almost where it's going to be harder to do that checking because you lose situational awareness. So it's this notion of when you turn on your GPS, you keep driving, but you're not quite sure where you are because you've given up control to the AI and you're just following it. And a third area that is also worth considering is skill degradation. So with the use of GPS, many of us have lost our ability to read a map. And so we need to make sure that when we introduce AI into our health services, that we train clinicians to work with them safely and effectively. And what that means is that we need to be vigilant to the effects of automation bias, to the effects that these systems are going to have on mental workload, on situational awareness, as well as what kind of skills that they're going to degrade. So let's summarize and conclude. We've looked at AI or machine learning based systems in healthcare. We've specifically looked at their applications in supporting clinical decisions. We've seen that AI can provide information to clinicians, it can assist humans in making decisions, and it can also provide those decisions themselves. The last mile of implementation is highly significant. This is where we take an AI system and we need to make sure that it's going to work for doctors and nurses in our healthcare settings. We need to make sure that clinicians are appropriately trained to use AI. We need to consider the effects of automation bias, what these systems are going to do in terms of imposing more work for our clinicians. Will they make them lose situational awareness? And also what kind of skills they're going to degrade. We're interested in a broad range of areas from real-world use of these systems. We're also interested in looking at AI in resource-constrained settings. The human AI interface is really important. There's lots of important problems to be solved there. And of course, we're interested in the implications of these systems on patient safety, what kind of ethical conditions or ethical constraints they're going to impose, and also how we're going to make our health systems more environmentally sustainable. Thank you for your time today, for listening to my Study Australia Masterclass. I'm Professor Farah Magrabi from Macquarie University.